So Mick, tell us about the iBody and why as a scientist you find it fascinating.
So the iBody is a very small protein. It's based on the shark antibody, and it's a really fascinating molecule because it has this long loop that seems to get into places on proteins that most other small molecules or monoclonal antibodies can't get. And so I think it really provides us an opportunity to get tools that will be able to answer some really important biological questions, as well as maybe get a product that will make an impact in disease.
Tell me, so you're an expert in phage display. Tell me a bit more about phage display itself, what it is, and how do you use the technology to screen the iBody library?
So phage display is a really cool technology, and I first heard a guy called Greg Winter talk about it back in 1993, I think it was, and I thought, I've got to get into that technology. It's a really cool molecular technique for being able to take large diverse samples of molecules and find the ones you want. So we can, for example, in the iBody library, we have about 20 billion different compounds or different variants, and we put them all on these bacterial viruses, so they're all on the same bacterial virus, and we select then the ones that bind, and we simply amplify them in bacteria. So you can go from 20 billion down to just a few molecules that are the ones you want. And in fact, it's called panning, so it's a little bit like finding those important molecules in among a lot of other stuff.
And finally, nearly 12 years at AdAlta. What's been the most exciting thing, would you say, that's happened during that time?
Well, of course, it's been a very exciting time, the whole 12 years. And obviously, at the moment, what we're doing, trying to get this molecule through toxicology and into the clinic is probably the most important thing we're doing. But probably as a scientist, the most exciting moment for me was when we first took the iBody against CXCR4, which is our target, and we first showed in an animal that it had a biological effect. Because sometimes that's very difficult. You get lots of molecules, and the chances of them having an effect are often very low. But when we first saw that data that said when we injected it into an animal, it had an effect, I think that was the biggest thrill for me, scientifically at least.